Okay, hello folks, it's RC62 doing a little vlog cruising here, and I have another little topic for everybody. I tend to try to stay away from hot button topics like religion and politics. Everybody's got their own opinions, and one of the quickest way to lose friends is to get into an argument about politics. So I won't go too deep in my philosophies on politics, but I will talk a little bit about healthcare. Now, no matter which side of the aisle you stand on when it comes to healthcare, I'm hoping that most people agree that healthcare in this country is not what it really should be. I mean, we always talk about America's number one. Well, it's not in healthcare. In fact, it's pretty far down the list of developed countries as far as healthcare goes and the health of our citizens. And I know some people say, well, it's because as Americans we overeat, we don't take good care of ourselves, but I don't think that's it. And let me give you a little hard evidence here of what I see as wrong. As many of you probably are aware, my wife got really sick about a month ago, and she had a bad reaction to some medicine the doctor had given her, and she wound up in the hospital. Very, very seriously ill. Her liver was shutting down. She was having a lot of pain, a lot of problems. And while she was in the hospital, they found a cyst on her ovary, which they thought might be cancerous. So we let them do the laparoscopic surgery and remove it. My wife was in the hospital for about 6 days. And we just got the hospital bill the other day. $47,000. Now, I have decent insurance. Got to fight with them once in a while to pay stuff, but overall, I got good insurance. I'm not unhappy with it. But looking over the bill, and it was just a summary, I mean, some of it was kind of ridiculous. It was $8,000 for a semi-private room. There was a charge of $2,500 for room supplies, and I guess that's like toilet tissue, towels, the little water bottle they give you to drink, bedpan, I don't know. But $2,500 for that, $4,000 in medications, which, at that price I could have went down to my local corner drug dealer and bought painkillers for, probably for a fraction of that. I'm not complaining about the care she received in the hospital, but in looking at that bill, $47,000, and it's going to cost me out of pocket a few thousand, which is another thing. The way my insurance is set up, I do have an out-of-pocket, I have a copay, and when they list it, it's like your out-of-pocket expense for the year, your out-of-pocket, out-of-network expense for the year, your out-of-pocket copay for the year, your out-of-pocket, out-of-network copay for the year, your out-of-your-asshole pay for the year. I don't know. I mean, I know that at some point I'll hit a limit, but it's going to be several $1,000s out of my pocket, and thank God I've got a good job. But what if I didn't? What if I didn't have a good job? What if I didn't have decent insurance to pay all this? My family would be totally screwed. So and I am relatively satisfied with my insurance. I mean, it's a pretty decent deal, all in all. But man, if I was out of a job, and a lot of people are right now, what would I do, man? What would I do? What would my family do? We'd be bankrupt. That's all there is to it. Either we'd be bankrupt or my wife would have died because we would not have been able to afford to let her stay in the hospital. And there's a lot of people out there that are in that same boat. And it's really, really sad. that we can't come up, and we as Americans cannot agree on decent health care. Other countries do it, and I don't know how you feel about socialized medicine, or if socialized scares the hell out of you because it's commie or some crap. We have Social Security, so hopefully that doesn't. And I hope most of you don't buy into a lot of the crap that is being thrown back and forth by both the Democrats and the Republicans and the independents and the different news networks. Kind of think for yourself here. If you don't agree to some parts of it, that's fine. That is your right. But anyway, I hope you'll kind of look at it with an open mind and realize that there are problems in this country with health care. And it'd be really nice if our politicians would stop arguing about it and put something into place that would help us. I don't know what that is. I really don't. I mean, I'm not a politician. I can't read those policies and make heads or tails out of them. I don't think too many people can. They're written by lawyers for lawyers. And anyway, that was it. Ranting over.